When does the infection start? Like it's gonna be, oh, it's like for this, it isn't
Oh, yeah,
like
no, he's the Thursday.
like the,
Yeah. Yeah.
I was gonna come by tomorrow.
Tomorrow's fine.
She's gonna do Florida. You gave me like the oversight. Now I just have to stick over it.
Come down tomorrow because
I do 3 people, so well.
one also
Hey guys, you ready to go? Yeah. Great. Okay. Thanks for having me back. See some of you board. I hope you all had a happy Thanksgiving, both those of you who work here and those of you who stayed home. It's good and low. Tonight we're going to talk about sepsis. Who here has ever heard of sepsis? Ever heard the word bandied about the ED? Anything? Okay. So you all are familiar with the term. We're going to talk about what it means, the difference between sepsis, severe sepsis, and septic shock, and how it works physiologically, what it does to you, what you can expect to see in the patients, and what you can do about it in the pre-hospital environment. Again, if anybody can't hear me, just yell something, throw something in my face, etc. I've been accused of mumbling from time to time. This lecture will be just under an hour. I know you're busy, and then you and I both have things to do. Sound good? Yes. All right. Anyway, anybody ever been here? This is UVA. Nobody? Okay. If anybody's thinking about medical school when you're down here and you don't want to go to UConn or Syracuse or Columbia or wherever else, this is really good. Go here. All right. That's the only plug I'll put in. It's really good. Okay. So, in terms of sepsis, and we'll talk about what exactly it is. This is deaths worldwide, and especially in developing nations, versus deaths in America. So worldwide, one of the biggest causes, and this is as of 2002, so this might have changed a little bit, is actually HIV/AIDS. In America, the number one is ischemic heart disease. Who here's ever been to a Bojangles? That's it, right? How about McDonald's and had a supersize me anything? Y'all too young to remember when they used to let you supersize stuff? Anybody remember that? Yep. Well, somebody back the other day. There you go. Did you ever get the French fry that's like this large? You know, the thing that's bigger than your head? That's where the ischemic heart disease is coming from. Anyway, you notice though, the lower respiratory tract infections, i.e. pneumonias and that sort of thing, are number 2 worldwide, but they're number 4 in America, about 1.18 million. Diarrheal disease is actually number 4. This is actually a really big deal, especially in the developing world. And tuberculosis is down at number 9 in developing countries. This is probably fallen off the radar pretty quickly. But the point being that in the developing world and in America, although to a lesser extent in America, because we tend to kill ourselves rather than get some disease to do it for us, sepsis is a big deal. And increasingly, it is a big deal in healthcare. It is a big deal in hospitals. The CMMS, those of you who wish to eventually go into healthcare will become familiar with this, the Center for Medicare and Medicaid Services, which is the government arm that deals with how much money we get paid for Medicare and Medicaid patients, how hospitals and doctors are graded in terms of how they fix problems, is putting an increasing emphasis on sepsis. In sepsis, the bottom line for sepsis, if you remember nothing else, it is an inflammatory problem. Half of the issue is the infection itself, the pneumonia you got, the urinary tract infection you got, skin cellulitis that you got, bacterial gastroenteritis you got because so-and-so came to visit you for Thanksgiving and now you've got the same stomach bug that they do. And half of it is inflammation. Half of it is your body's own response to the infection. It's sort of like an autoimmune disorder. It's such an insane overreaction to the threat that it actually causes a lot of harm. Insert your own puns and jokes here. So, sepsis is actually Greek for putrefaction, or septic, which means to rot. If you've ever had any family members with sepsis, or you've ever, God forbid, been septic yourself, this is exactly what it feels like. It feels like your body and its various systems are betraying you. You try to do what you can to take care of the infection, and it gets worse anyway. So, first thing to understand is what exactly counts. Having a pneumonia or having, a cold does not count as sepsis. So they, instead of sort of the rough estimation of what it used to be in the 60s, where it's kind of something like this, probably, okay, sure. They actually came up with something called SIRS, which is the Systemic Inflammatory Response Criteria. What this is it's a series of numbers that for various vital signs, some of which you will be able to measure in the back of the bus, some of them you will not. And I don't expect you to suddenly start measuring all of these in terms of what counts as inflammatory response. Because everybody knows what that inflammatory response feels like. Fever, body aches, a rapid, thready pulse, the sweaty palms, you got the flu and you're under 9 blankets. And somebody comes by to give you, a drink or some chicken soup or something, and you take the blankets off and they're just completely wet with sweat through this hot, sticky mess. And you know what that feels like. But in terms of numbers, what does that actually look like when you show up at somebody's house? Because one of the big things I noticed when I went from being in the basic groups, where I started, which is where this comes from. I was going to wear the shirt, but it's too hot, so we did this. One of the big things I noticed was everybody gives you a ton of bookwork. And you get a bunch of numbers and stats. But what does this actually look like? What does it look like when you roll into somebody's living room and go, I think you might be septic? Well, what does that mean? What does that look like? So I'm going to give you explanations and examples and little pictures of what this, how it acts. I'm in the way of my own picture, sorry. Anyway, so you got to have 2 or more of the following, at least 2 of the following things to qualify as SIRS, or Systemic Inflammatory Response Syndrome. This is not the same thing as sepsis. We won't get there. So 2 or more of the following. You got to have a temperature over 38 or less than 36. So that's over 100.4 Fahrenheit or under 36. You can be really hot. Most people are hot. Some people can be really cold. You get an older person who's been in a nursing home and just has very little activity, is kind of sitting there shriveling until someone notices, they might actually be hypothermic. It has nothing to do with the fact that it's really cold outside. It has everything to do with the fact that they don't have enough metabolism going because they're infected to generate enough body heat to do this. Respiratory rate greater than 20, or a PaCO2 less than 32. What does this mean? Is anybody here even remotely familiar with ABGs? No, okay, that's cool. I don't expect you all of this to go over terribly well. Some of this was arranged from paramedics. If we don't have any, I will calibrate accordingly. But the point being, a lot of times when you have a severe infection, what you end up doing is instead of taking oxygen, make carbon dioxide, everybody makes some carbon dioxide, right? Instead of doing that, what you do is you make acid, lactic acid. Your blood turns to the pH of battery acid. Well, not literally, but it will. It will turn acidic. As a result, you know what else is acidic? Carbon dioxide, the stuff you breathe out. So your body senses it's getting really acidic from this infection. And do you feel any differently? No, you just feel kind of vaguely ill. You can't quite put your finger on what bothers you exactly. But your body senses that you're getting acidic from this problem. And it tries what it can to get rid of as much of that acid as it can, which means literally blowing out all the carbon dioxide in your system. Because carbon dioxide is actually an acid. So if I sit here and do this all day, and I blow out a ton of carbon dioxide, I will actually be less and less and less acidic. I can actually make myself basic. True story. A couple of years ago, I flew out to the middle of nowhere in North Carolina to take care of a really, really sick baby. And we're talking about like 3 months early, about this big, respiratory distress kid that was intubated. And they didn't have a ventilator for the kid that time. They didn't have anything. That's why they called us. We show up in a helicopter with all of our toys, and we intubate this kid, and they go, okay, Doug, you bag this child with a bag valve mask attached to an trachea tube. And the kid's like this big. You think I was freaking out? Oh, yeah. And so basically what I sat there doing was, you're supposed to bag about 12 to 20 breaths a minute for your average child, and closer to 20 or higher for your average infant, right? What do you think I was doing? Oh my God, oh my God, oh my God, oh my God, like that. For a good 5 or 10 minutes before anybody stopped me. The kid was intubated, you can't talk back, you can't say, I feel like that's too fast, Mr. Gallen. What are you gonna do? So what happens is, when we did the ABG of this kid, we've been ventilating him so much, breathing in and out so fast, that we actually blew off most of the carbon dioxide in the system, and we made him alkalotic. Did that hurt him? No. He's a child, he compensated like that. His pH went up to, what's your normal pH? 7.40 or so? Between 7.35 and 7.45, that's what your blood likes to be at. This kid got up to like 7.46 or 7.48. Noticeable. Did it harm him? No. But will these guys try to do exactly that? Blow off all of their acid? Yes. So you walk into somebody's house and they're sitting there going, I got a fever, and I don't quite feel right. I'm achy all over and I'm coughing for a while. And you notice they don't stop. They're still breathing like this. They're still breathing over 20 times a minute. Now what this does is it blows off all of their CO2. That's why this carbon dioxide level is under 32. Are any of y'all going to get an arterial blood gas measurement in your living room? No. I don't expect them to, and that's fine. But we will, and it will show that. A white blood cell count of less than 4,000 or greater than 12,000 or greater than 10% advanced. Basically what this means is when you go to the hospital and we get what's called a CBC, anybody ever had blood drawn? Come on. There you go. I don't feel so bad. When they check the white blood cell count, it'll be over 12,000 or under 4,000. What's one population of people that you and I have all talked about before that can't necessarily mount a sky-high white blood cell count, even in the setting of a bad infection? Wonderful. Old people. There you go. And what's the definition of old people? Greater than 20 years older than the oldest person in the room. All right. Heart rate, over 90 beats a minute. This is really common, especially in younger folks. Practically every child who's ever had a fever, every 3-year-old with a cold and a sniffle would probably qualify for all of that. So it doesn't really hold up as well in kids. But in adults, particularly the kind of middle-aged to older individuals that you will likely be taking care of most of the time for most of your calls this winter, most of this will apply. Heart rate over 90, temperature over 38 or under 36, respiratory rate greater than 20. Honestly, you can't pull this one off in the field. It's okay. And note that the blood pressure is not in there. Well, wait, I thought sepsis made your blood pressure drop. It made you really sick. Why is blood pressure not a factor? He's hypotensive. Doesn't have any septic? Well, probably, but you don't need it for this definition. Don't let anybody tell you that you can't be septic because his blood pressure is fine. You absolutely can. You compensate for a while, and we'll talk about that. Make sense so far? Sir?
Would their end title give you any indication of their CO, how much CO they're blowing off, or if they're blowing off too much?
It may register a large amount of CO2 exhaled, but this is an arterial CO2.
Right.
So
I
you
just
gotta-
didn't know if one would indicate another.
I mean, theoretically, if you were breathing really, really quick, you might blow it down. It might be off, but I don't think there's no definition in the SIRS guidelines for that. Good thought, though. Most of it is going to be on your exam file. If there's a technique in terms of numbers, that's pretty much all you need. So what counts as sepsis? You'll notice this definition kind of builds on itself. You got to have SIRS, 2 or more of those criteria, plus an infection source. Plus, what's wrong with you? Is it pneumonia? Is it a urinary tract infection? Is it a skin infection? Is it, some sort of stomach infection? You have colitis? You have the stomach bug. By the way, what is the stomach bug? When people says, I have a stomach bug, what does that mean? What do they really mean by that? Anybody know? Put it this way, let's go the other direction. Who's ever had a stomach flu? There you go. When people say that, and you hear a lot of that this winter, that's usually what's called a gastroenteritis. That is a viral intestinal infection, usually in your stomach, your small intestine, that lasts about 72 hours. It's extremely communicable. Sorry. It is marked by vomiting and diarrhea. It has to be coming out both ends. As kooky as that sounds, it's exactly what it is. Enterovirus, rotavirus, all kinds of stuff. Usually viral infections, usually not bacterial. Can that make you septic? If you're an older person and you've been vomiting and having diarrhea all day, get really dehydrated and confused, and that make you dehydrated enough to be tachycardic with a heart rate over 90? Sure. Can you get a fever from that? Absolutely. Is that the only thing that this will do? No. For extra credit, what are the top 2 sources of infection in old people that we talked about last time? 70% of all infections fall into two categories of overdose.
GU, urinary.
GU and what else? There you go. GU and pneumonia. Urinary tract infections and pneumonias. And those are going to be the overwhelming majority of what you will see. Mark my words, this winter, the vast majority of what you will take care of will be medical patients. It will not be trauma, it is never trauma. About 80 or 90% of everything the ER deals with is medical, not traumatic injury. And of that, only about 80% of the trauma is blunt trauma. So the really cool stuff, the really headline-grabbing stuff, where so-and-so gets shot in the chest and they rush into the ER and it shows up on TV, no. Overwhelming majority will be medical issues, especially middle-aged older people. I guarantee you, all of you will see at least one of these this month, next couple months if you're all running, especially around Christmas. So, most sources of sepsis, really bad sepsis, are bacterial. Bacterial pneumonia, bacterial urinary tract infection, bacterial colitis, or bacterial esophagitis, stomach infection, all kinds of stuff. That kind of stuff is what really hurts you. Viruses can dehydrate you and make you feel terrible. They can make old people dehydrated and get them to feel right. But the really kick your butt, kill you infections are usually bacterial. Everybody know the difference? Put it this way, anybody not know the difference? It's okay to ask. I was a molecular biology dork before I did any of this. It's okay to ask. I'm the person to ask. Okay, everybody's got that. All right. Okay, so we went from SIRS to sepsis. Note, blood pressure is still okay. The blood pressure people, the hypertensive people, the people you need to be afraid of. The normal blood pressure people can deceive you. We'll talk about why. At this time, when you're septic, I stress this because the wording and how you say it is very important. When you're septic, your organ function is still good. Kidneys still work, lungs still work, still pee, brain's still working, it still makes sense, make logical sense when people ask you questions, you're not sitting there, confused, everything's still functioning. Now, we upgraded to severe sepsis. That's sepsis plus end organ dysfunction. Now you are sick enough that something broke. Common problems. For lack of a better word, I mean, really simple level, your brain broke. And so you get a call because grandma is altered. Grandma has a fever of like 38.9. She's got a heart rate of 110. The lungs sound like crud. And you ask her, so ma'am, what's bothering her? And her response is, ah! What? Oh my gosh, that's not like her. And the family's sitting by you freaking out. What's going on? Is this a brain infection? Probably not. So why is her brain malfunctioning? Anybody know? Everybody has a guess based on what we're talking about? What's that?
Not confusing?
Right, not confusing. Not enough blood flow to the brain, or her body is loaded with what's called cytokines, which are inflammatory mediators, which mess with how you think. And fever will also do that. This is delirium. So everything fails. Respiratory failure, heart failure, kidney failure, brain failure, confusion, disorientation, encephalopathy. Note, at this point, severe sepsis, blood pressure is still good. It's still good, it's still good. So we might as well talk about this, because then you get into septic shock. Who's ever heard of compensated shock? Okay. In my opinion, that is a rather silly term. Compensated shock is the technical term for shock. You're in sepsis, but your blood pressure is still okay, and it hasn't dropped yet. Well, if you're in shock, your blood pressure is low. So it's kind of like being pregnant. I mean, you're pregnant or you're not. You don't have compensated halfway pregnancy. The deal with this is, in septic shock, it's severe sepsis, which is sepsis plus end organ dysfunction, plus refractory hypertension. This is the dangerous, spooky one that everybody's afraid of. This kills people. Septic shock. This is when the infection becomes so overwhelming and your body's own response to it is so nasty that your blood pressure tanks. Your ability to keep your blood fusing, your ability to, air goes in and out, blood goes round and round, everything else is a problem. Your ability to do that fails. And that's when your blood pressure goes off the cliff, and when that happens, then you're in real trouble. Something to think about. Young kids, 5, 8, 10 years old, admittedly, most of the people in this room compensate against infection very, very well. You might get the flu this year. I hope not. I hope you don't, but you might. You might get a stomach bug this year. You might even get a pneumonia this year. I hope not, but you might. You guys will weather that storm better than anybody alive. Certainly better than the topic of our last lecture, geriatric patients. And in part, you may be dehydrated. You may be feverish. You may be massively weak and nutritionally depleted. But your blood pressure will more than likely stay up and you will never get here, even though you have pneumonia, even though you have a bad UTI, you have the flu or something. Because you can compensate, you can make up for it. How do you make up for it? Anybody ever heard of cardiac output? Cardiac output equals heart rate times stroke volume. How fast your heart goes, and how much blood you move in one contraction of your heart. You guys will compensate beautifully despite being really ill, because you can maintain that vascular tone, you can keep your blood vessels squeezed down tight so you keep perfusing all your organs, and your heart can accelerate to 130 or 140 for hours on end while you down Gatorade and liquids and chicken soup or nausea medicine or whatever it is that you need, or antibiotics or whatever, and fight it off. Like we talked about with old people last time, how well are they going to accelerate to 150 and stay there for 2 or 3 days? Not terribly well. Younger people compensate longer, their blood pressure drops later. When the blood pressure drops, it's a bad sign. If you get to septic shock with the hypotension, you are already behind the 8 ball. Has everybody ever played pool? You understand what behind the 8 ball means? Just checking. Okay. So, case in point. I had a little girl. Name was Alexis. 7 years old, 8 years ago. Had diabetic ketoacidosis. Anybody ever heard of DKA? But pretty much of it. Okay. Bad, not technically sepsis, but similar situation. Extremely dehydrated, diabetes out of control, acidotic. Started losing weight, was initially overweight, was trying to lose weight, got on this diet, changed her diet, started exercising, started losing weight. Mom was super proud of her. You're losing so much weight, honey. It's great. Yeah, but I have to pee all the time. Oh, it's okay, honey. You're just losing lots of weight. Kept losing weight, kept losing weight, kept losing weight. Started to feel like a vampire. Slept all the time, drank all the time, was still thirsty no matter how much she had to drink, still hungry no matter how much she ate, and kept losing weight, kept losing weight. Came in with a blood sugar of 600 and a pH of 7.05. After 7.0, that's pretty much getting into going to kill you territory. And yet she was sitting there talking, looking around, yeah, I feel kind of funny, but I'm okay. How did she survive that? How did she not drop her blood pressure despite being that dehydrated? How did she not become confused and altered and pass out despite being that sick? She compensated. Her heart could accelerate appropriately. Her blood vessels could still clamp down and keep that blood pressure normal. She could soldier through because she was 7. But if she had been 75 with those kinds of numbers, dead or really, really ill, her blood pressure would have tanked if she was 75. That'd be septic shock. See the difference? Older people will drop their blood pressure earlier, and it will be tough to fix. Younger people will maintain longer before their blood pressure drops. And when it goes south, it goes south. Kids tend to go off a cliff when their blood pressure drops. That's a bad deal. Your job is to see this coming and intervene, primarily by giving them fluids or getting your medic over there to give them fluids early. Because it has actually been shown that the first hour of emergency care that they get from you, from me, in the ED, actually improves their outcome long term. It decreases the length of hospital stay. Not by that extra hour or 2 that it took us to intervene, but by like a day or 2. Because we intervened early before the downward spiral happened. Okay, so if we can jump in and we can intervene quickly and see this happening before it actually becomes the blood pressure dropping, grandma's confused and talking to God on a 2-way radio in the living room with a fever of 109 and you can fry eggs on her head. Before this stuff happens, if we can intervene and we can resuscitate early, if we can recognize early, you can actually save people. Don't say, oh, I'm just a basic, I'm just an ambulance driver. No. Your job is to be a set of eyes and ears and to intervene on this stuff as soon as you can. Because septic shock, not sepsis, not severe sepsis, septic shock carries a mortality of about 50%. Even with all of our toys, central lines, IV antibiotics, the ability to go in and surgically remove the necrotic tissue or whatever it is that's bothering them, 50%. In America, in 2013, with our gigantic, ridiculous, over-the-top, non-sustainable healthcare expenditure, half the people die. So if you can get in on this early and stop this from happening, you can make a serious difference. So here's another way of thinking it, if you prefer pictographs. Here's sepsis, the systemic inflammatory response syndrome plus infection, about 400,000 a year. Here's severe sepsis, systemic inflammatory response syndrome plus infection plus organ failure, about 300,000 a year. And here's septic shock, all that plus their blood pressure dropped. Blood pressure dropped below 90 systolic. Technically, there's another measure you can use called a MAP, mean arterial pressure, but I'm not going to go there. Ask me later if you like. And here's the SIRS, systemic inflammatory response criteria again. Temperature over 38, pulse over 90, respiration's over 20. You're not going to be able to get blood cells in the back of the bus. And here's your mortality as you go up. 15%, 20%, 45%, and so on. Make sense so far? Am I running away from you? Are we okay? Any questions so far? Okay. So, this was fun. I randomly sprinkled in pictures like this because I know if I listen to anybody talk at me for more than a couple of minutes, I just kind of go to you where we're going. So this was a guy, we decided that we were going to do a mass casualty incident training drill. We took about 24 of people exactly your age, stuck in the back of the school bus and hit the car. We pretended that we hit the car. We didn't, you guys weren't in the bus when you hit the car. But the whole point was how you got everybody off the bus and how you triage everybody afterwards. Which I will one day do a lecture for that on that for you guys as well, if you so desire. How to deal with mass casualties. For example, the Metro North Railroad train crash 2 days ago on the route that I took to get back from home the day before. I think that did weird me out a little bit. 63 injured, 4 people dead. You don't think that can happen here? How about last year, the Metro North Railroad? Just near here. I guarantee you, we ought to have that done. Anyway, after that, we had an equipment show basically on how to use different stuff. This is an acetylene blowtorch that cuts right through steel as if it's butter. If you absolutely positively have to cut somebody out of the steel structure, that's what you use. For any tool geeks in the room. So, here's the trouble with sepsis. Here's what makes it so tough to fix, and how it can sometimes become a runaway train in terms of inflammation and infection. Sir William Osler in 1904, who I admit I don't know a whole lot about, said, except on a few occasions, the patient appears to die from the body's response to infection rather than from the infection itself. Well, how can that be? How can it be that you kill you? I thought the pneumonia was going to kill me. What do you mean it's my fault? Is it something they did? If only they got the flu vaccine and this wouldn't happen, is it that kind of thing? Did their body turn on them? Did they just give up? Nope, I'm not going to fight this, I'm done. Not that kind of problem. This is an immune system problem. Give me an analogy. Have you ever had a mistake you made or something that you did wrong and you become convinced, I'm never going to let X happen again. I will not do that. And the next time X comes up, like, oh man, I'm not going to miss this twice, and you jump all over it, and you jump on it super hard, and you go overkill to the extreme trying to prevent that from happening to the point that somebody says, you got to stop. You don't need to get this on. You know what I mean? They're out of a situation like that. That's what your body is doing in sepsis with inflammation. What it's doing is it is trying so hard to fight the infection that it throws every inflammatory, destructive, biological missile, nuke, etc. at this thing possible. And in the process destroys everything in the area, including you. And it becomes a runaway train, because then it sees all the local destruction it has caused in the cars of fighting pneumonia, or fighting the urinary tract infection. It goes, oh my God, the fire is even further out of control than we thought. Quick, throw more stuff at it. which causes even more destruction and more of an inflammatory reaction, and so on and so on. So, put it this way. Let's say you get the flu. Who's had the flu? All right, so I got the flu. So I was unlucky, you didn't get my flu shot, whatever. What that does is that causes injury to the endothelium. Who's heard of endothelium? Nobody. Okay. Somebody. Back me up. What is it?
Lining of the vessels.
Exactly.
The line of respiratory tract, it's a tissue layer.
Right. The endothelium is the inner lining of all of the vessels, primarily blood vessels in your body. Inside your blood vessels, the big ones that go in your neck, the little teeny tiny ones that go into your hands, everything, there is a single cell layer thick lining that literally coats the inside and makes the wall, past which all the blood actually flows. In the process of this infection, the infection of your body's white blood cells and this sort of biological fist fight that ensues between those two rips up that wall. I'm a sci-fi geek, so I guess we're going there. But who saw, I don't know, I got it. Who saw that Michael Bay movie, the last Transformers movie, where Chicago got cratered at the end and there was a big giant fight, a bunch of buildings fell down, stuff like that? That kind of analogy. When you get such a giant tussle that it destroys everything in an area, it actually causes a lot more harm than good. In the end, it took out like 12 bad guys in the entire fight. Half of Chicago got wrecked. That's kind of what's going on. I mean, I know that's a somewhat childlike analogy, but that's exactly what's happening. What's going on is that the white blood cells versus bacteria engagement that's going on here destroys all the endothelial cells that are lining your blood vessels. Your body sees that and goes, and for lack of a better word, oh my God, and throws cytokines, which are inflammatory markers, lymphocytes, which are a special type of cell-mediated white blood cell. It throws complement-added, a variety of tissue factors whose sole purpose it is to engage and destroy foreign pathogens, irrespective of the fact that it may rip up everything in the surrounding area, including you. Your organs, or wherever this fight happens to be taking place, whether it's your lungs or your liver or whatever else, are casualties of war in that situation. Huge chunks of your lung can be destroyed. Huge chunks of your stomach lining can be completely denuded and wiped clean. All the cells on them that are responsible for absorbing stuff like food and water and that kind of stuff are destroyed, at which point you cannot do anything with them anymore. They are hollow sacs that don't absorb anything. Imagine what would happen if you ate like a cracker or something. This went all the way through your body and none of your organs absorbed anything. What would happen? It goes right through you. Who's ever had the flu where you drink something and about 5 minutes later you have to go to the bathroom? Nobody ever had that happen? The rapid transit effect? That's exactly what this does. Similar thing happens. It activates all your coagulation, all your clotting cascades. Remember how we talked last time about what's called DIC, or diffuse clot bleed inflammation that you get with infections? What this will do is it will actually, as part of the inflammatory response, irrespective of the fact that it's not actually the body's fault, it turns on all of your clotting factors, makes you clot a bunch of blood. And then fibrinolysis, which is breaking down the clots, that goes down. I'm sorry, did I miss something? What about pneumonia involves I've got a clot all in my blood all of a sudden? I can't breathe, quick, make clots in all my blood vessels, block everything, go, that's gonna help. So that doesn't do anything. It doesn't help you at all. What it does do is causes blood clots in all the blood vessels that go to all these vital organs, including the ones that are hurt. You think your liver or your lungs or your kidneys or your brain respond terribly well to having all the blood vessels that serve them suddenly clotted for no apparent reason, other than that there's a gigantic fight going on between the bacteria and your white blood cells elsewhere in your body? You're not helping. But that's exactly what it does. It's your body's fault. That is why sepsis can be so tough to stop once it gets going, and that's why your intervention early on should be helpful. So this is another way of thinking about it. This is the severe sepsis where you get end-organ dysfunction. What does this look like when you show up in somebody's house? Brain failure, right? Altered level of consciousness, confusion, psychosis sometimes. Grandma doesn't seem like herself today. Johnny's been laying on the bed all day, just really tired. Just won't talk to me, just kind of gazing straight ahead like this. Respiratory failure. You don't necessarily have to have a respiratory infection to do this, but it helps. Tachypnea, rapid respiratory rate. Your oxygen level goes down, you get hypoxic. You're not going to be able to measure this, but you will be able to measure this. Pulse ox under 90. You're going to be hypoxic. Liver failure. The infection can be in your liver, it can be hepatitis, or your liver can just be one of the casualties of the infection going on. So they end up jaundice. Who's seen people jaundice? Who's seen like really highlighter colored yellow jaundice? So you guys get that image in your head? Heart failure and hyperperfusion, tachycardia, blood pressure drops, hypotension is usually the last thing to happen. Do not think that because they are normotensive that they're safe. They can deceive you. The hypotension is the last thing to happen. If this occurs, it is too late. We're closing on too late. Do not think that because their blood pressure is normal, that they are going to be fine. This is your chance. This is your chance to intervene and get fluid back in them, get them perfused better, increase that cardiac output for them, help get them on the right path. Do not allow that to lull you into a false sense of security. Kidney failure. Everyone knows what this is. Start retaining water like you're the Stay Puft Marshmallow Man. Don't pee much, and your creatinine goes up. And then we get into the thing we talked about with the clot, bleed, DIC, disseminated intravascular coagulation. We do a whole lecture on that, and some people do. But the whole idea of everything clots and shit. And then you get what I call off the cliff. I made this at a time when we were talking about the fiscal cliff and sequester, and it used to be a funny joke, and now it's a reality. But anyway, so the point is that once this thing really gets rolling, it can get out of control pretty quickly. And so septic patients become very dependent on high-intensity medical care very quickly. These are people who they've been compensating for 3 or 4 days, and then they start to really go downhill. And it's like a snowball rolling down a hill. And they get very, very ill. And that's usually when they call you. Well, how long have you been this way? About 3 or 4 days. What's the first inclination in your head? Why didn't you call 3 or 4 days ago? Why have you been sitting on this for 3 or 4 days, right? Natural, totally human question. Don't ask that. But a totally realistic thing to think, right? Yes, ma'am. Sure. Mind if we jump sideways for a second?
What was the question? Just another question.
Yes. Oh, the difference between altered mental status and psychosis. Altered mental status is a blanket term that means confusion, improper processing of information, not answering and responding to questions correctly. You're trying, but you don't quite make sense. So, how are you feeling today? I'm just, Psychosis is radically different. Psychosis is what you think of in quote-unquote crazy people. Psychosis is schizophrenia, for lack of a better word. Now, it's not quite that simple, but that's the image you should have in your head. Psychosis is extremely agitated delirium. Psychosis is being manic. I'll give you an example. I love real-world examples. This is what psychosis is. I spent a month in a criminal psychiatry ward during my psych rotation in medical school. And this was largely for people who had been psychotic, and while they were psychotic and having delusions and hallucinations and seeing things and hearing voices, which is what psychosis really is, they would commit crimes because they were convinced that the ninjas in their head were telling them that this house was theirs, and therefore they should break into it. Oh my God, what are you people doing in my home? They weren't criminals, they weren't vandals, robbers, they were just psychotic. The voices were telling them this is where their house is. My personal favorite psychotic delusion of all time was I had a guy who was convinced that he had microchips implanted in his eyeball. He used those microchips to explode airplanes. So he goes down to Washington National Airport, I kid you not. He goes down to Washington National Airport one day and staring out the window like this for like 3 hours. Just non-stop. Finally, one of the security guards comes over, what the hell are you doing? He goes, by this point, he used 3 sheets of glue in glass. He turns and goes, blew up one of your airplanes. What do you think about that? Come here. That's psychotic. That's very different from confused, from low, from sort of a lack of mental energy, from being unable to answer questions appropriately, from being acting differently.
Do you have to have like pre-existing condition or can you come to psychotic?
Oh, when you're sick like this? Most of the time when they talk about that, what they're really talking about is like a hyperactive delirium. Like we talked about last time with older people who become so agitated and so altered that they start screaming wildly, incoherently, punching people. Does having a predisposition to psychosis, like if you have a history of depression or schizophrenia or something, does that help? Yeah, sure, it makes it more likely. But you can get pretty crazy just from being delirious. And it's not that grandma at the age of 75 suddenly had a schizophrenic break. That doesn't happen. But they can look really similar to it because of how profoundly altered they get. I've had people shrieking at the top of their lungs about an invisible baby that was born 20 years ago. People who are 80 years old and sick don't get psychotic in terms of like schizophrenia, depression, bipolar disorder out of the blue like that. That's the kind of stuff you've had for 50 or 60 years prior. But they can act a lot like it because the infection is changing how they think. They can look psychotic even if they don't have a history of being psychotic. And that's what freaks the family out, and that's why they call them because they're really not acting like themselves. It's the infection that got to them. In younger people, yeah, it might actually be psychosis and maybe drug abuse and something else. In old people, pretty unlikely. They would have new onset schizophrenia at 70%. So, oh, anybody else? Okay. Talking about that. So, how long does this take? Shock, if you're going to get septic shock, it's going to happen over about 2 days. Your kidney failure, and as a result you're not peeing normally, takes about 1 to 3 days. Nervous system dysfunction, look at this, it's like 9 days. Being confused, being altered, not able to make sense, not quite there, not acting like yourself, up to 9 days out. You're still doing it. ARDS, which we'll talk about in just a second, acute respiratory distress syndrome, can last up to 12 days. Everybody see that? This is a long-term thing. If this really gets rolling and the train leaves the station and you're really severely septic and you end up in the ICU, this is not the kind of thing where we give you some antibiotics for home next day. If you get to this point in the progression of this disease, this is a real issue. This is way too busy of a slide. See the big green stuff, blood pressure drops and organs fail? That's all you need. Basically what happens is, we talked about it before with compensation. What happens is the infection shows up, inflammation cascade gets rolling, your heart tries to compensate by beating faster. All your blood vessels are really stupid and they reflexively dilate. They're really large and they spring a bunch of leaks. Why in God's green earth would you do that? I'm trying to send a bunch of blood to vital organs that are injured, sick, or infected. I'm trying to send the white blood cells, I'm trying to send oxygen, I'm trying to send nutrients. Why in the heck would I suddenly dilate all my blood vessels to a gigantic size, which drops your blood pressure into the drink, and spring a bunch of holes so I internally hemorrhage everywhere? That's the kind of thing I would expect somebody deliberately trying to kill me to come up with. But you will do it. As a result, your blood pressure drops and your organs fail. That is not the infection's fault, that's your body's own inflammatory cascade's fault. It's not wrong, your immune system isn't broken, that's just how we operate as human beings. And that's a defect that honestly we can't fix. And it results in that. Everybody with me so far? Did I have more stories, less stories? I have plenty of stories. More stories! Okay. All right. So I'm going to talk about a couple of brief instances of organ system specific badness, i.e. what sepsis will do, and then we'll talk about what EMS can do, and then time to go home. So, ARDS, or acute respiratory distress syndrome. You may see some people labeling this adult respiratory distress syndrome. It's the same thing. Adult respiratory distress syndrome is a stupid name because children can get this too. And there's no such thing as CRDS. So basically what this is it is a non-cardiogenic pulmonary edema. What the heck does that mean? You've heard of congestive heart failure. Where does the blood like to go when you're really having bad CHF? Where in your body does it go? Deep. Where else? In your lungs. Who said lungs? Okay. What does that look like? When you walk up to somebody who's got ARDS or who's got CHF or something, which looks exactly the same, how does that look when you walk into their house?
Sometimes it can be like the tripod like position.
Or you can be tripoding?
Right. Hard time obviously breathing.
Breathing?
Diaphoretic, maybe.
Sweating? Giant legs like tree trunks with all the extra fluid. You listen to their lungs. What do their lungs sound like? Crackles. What are crackles? It's fluid. It's water. Why in God's green earth would they have that? They've got a urinary tract infection, or they've got a bad burn or something. And all of a sudden they have fluid in their lungs. What happened? Did he go, well, I have a bad burn, time to end it all and gargle fertilizer? No. It's not his lungs' fault at all. Why does he have this thing when the infection doesn't necessarily have to be in his lungs, it could be elsewhere? He's cellulitis. What's up? Darn, I was hoping somebody really jumped the gun on it. It's all right.
It's on the slides, it's increased vascular permeability.
Look, I mean, you know, if you guys insist on reading what I put up here and stuff, fine. The point being, that's exactly right. When that happens, how does that translate? Vascular permeability. Anybody throw out a guess? I mean, whatever that means. How does that translate into fluid in your lungs? Where's that fluid coming from? How does that happen? Any idea?
Capillaries are leaking.
Yeah. So your capillaries are leaking. It's your blood. It's your fluid in your blood. It's your plasma. All those alveoli in your lungs, all those little air sacs, all the little tiny blood vessels around past your lungs, if those all suddenly become really permeable and full of holes, and your blood vessel wall looks like Swiss cheese, and anybody who wants to can jump in and jump out at any time, all that fluid has to go someplace, and it goes elsewhere. That's why people who have sepsis are often really puffy. And you get liters, third spacing. You get liters and liters and liters of fluid put into them to counteract exactly this. Only the blood vessels are still full of holes, and so eventually they look puffier and puffier, and it becomes their puff marshmallow man type thing. And their lungs look like that. Doesn't it look like a bad case of CHF? It's not their heart though. They don't have a history of congestive heart failure, but yet they have a lung X-ray that's full of fluid. It's their fluid. It's their body's own blood vessels that are leaking. Exactly right. Actually, the #1 cause of ARDS is sepsis. You can get it from other stuff, bad crush injuries, bad burns, bad trauma, but actually the #1 cause of ARDS is sepsis. There is such a thing as ALI, but this is, for anybody who's interested and wants to delve into it, you can ask me later, this is basically a ratio of the oxygen in the blood to the percent of oxygen you're getting. If that's under 300, it's ALI. If it's under 200, it's ARDS. Functionally, I don't care. If they have that kind of X-ray, I want you guys to be able to pick up rails, crackles. I want you guys to be able to understand that they're short of breath, they might be tripoding,